Hi, everyone. We're really honored to be here today. Thank you to the National Collaborating Center for Environmental Health for coordinating this webinar. As Tina had mentioned, my name is Carlyn Allary. I'm originally from Treaty 1, from Winnipeg. I'm a member of the Red River Métis as part of the Manitoba Métis Federation, and I work as a research associate at the Canadian Climate Institute on the Indigenous research team, alongside Maria Shallard, who is the director of the Indigenous research team here, but could unfortunately not make it today. But Maria has really been a guiding force in this work, and her leadership and insights have been really instrumental in shaping the Healthy Energy Homes project. And for those of you who don't know us, the Canadian Climate Institute is one of Canada's leading climate change policy research organizations. We're a nonpartisan charitable organization as well, made up of approximately 30 to 40 staff across the country, in addition to a board of directors, an expert panel, and a council of advisors. And through our Indigenous research stream, but also across the Institute, we're really committed to ensuring that our work supports Indigenous self-determination and that Indigenous ways of knowing, being, and doing are reflected in policy recommendations. We really do aim to amplify Indigenous-led research and Indigenous voices through our work. And I'll pass it on to you, Kayla.
Yes, thanks, Carlyn. So as Tina said, I am Kayla Fayant. I am from Fishing Lake Métis Settlement, and that's where I'm joining from today. So that's in Treaty 6 territory here in Alberta. I, again, as she mentioned, am a program manager and regional energy coach at Indigenous Clean Energy. So we are a not-for-profit that operates Canada-wide, coast to coast to coast, supporting Indigenous communities in achieving energy sovereignty. So part of that work is our Bringing It Home team, and our Bringing It Home team focuses on the residential energy efficiency side of clean energy. Our team really works towards the goals of healthy, safe, durable, and affordable housing for all Indigenous peoples. So we're doing that work through programs like our Project Accelerator and this project, which is the Healthy Energy Homes project. So I'll tell you a little bit about what the project is. So Canadian Climate Institute and Indigenous Clean Energy came together to explore how climate change is a health issue. Together, we released a scoping paper, which is titled Beyond Sustainability, The Power of Indigenous Healthy Energy Homes. Um, the paper really discusses how efficient clean energy um, in Indigenous housing has the potential to contribute to a dramatic reduction in exposures to risks and health, improve Indigenous wellness, and contribute to climate change resilience. So through this session, we'll be talking about what healthy energy homes means, why they're needed, what barriers are preventing it, and what's next for this project. Okay, so we want to start by reflecting on what we all think a healthy home is. We're launching a Slido activity right now, so we'll give you all a couple minutes to join the Slido. There's both a QR code to join from your phone, or you can enter the link in on a browser, and you would just navigate to slido.com and enter the code on the screen in, and enter what word do you think of when you hear a healthy home? And we're getting some results in. Looks like safe is one that's coming up a lot. Warm. clean, definitely mold free. So yeah, so we think healthy homes are homes that are free from mold, from anything that can impact the health of the occupants. They're affordable, they're not overcrowded, they're well maintained, they support the well-being of the occupants, and they're designed thoughtfully. So these are the characteristics we want to see in Indigenous homes across Canada, but due to a range of issues that we'll go through today, it's not the reality for most Indigenous communities in Canada. So we can go on to what we are seeing if we have
Ooh,
Johnson, yeah.
thanks, Kayla. So, as members of different Indigenous communities across the country, Maria, Kayla, and myself have encountered the impacts of poor housing in our own lives, and that lived experience has shaped how we approach this work and really reinforces just how important improving Indigenous housing is to us. And so, to begin, I want to provide some context for why healthy energy homes and this work more broadly is so crucial. In 2021, nearly 1 in 6 Indigenous people lived in dwellings needing major repairs, a rate that is nearly 3 times higher than for non-Indigenous Canadians. And homes that require major repairs are less likely to be energy efficient, and these efficiencies also mean that households need to spend more on home heating and cooling, which can create a significant economic burden, resulting in energy poverty. And according to data from Indigenous Clean Energy, over 133,000 Indigenous homes are in need of major energy upgrades. Mold is another serious, as we saw in the Slido as well, mold is another serious health hazard in Indigenous communities. And according to the Assembly of First Nations, in 2013, half of Indigenous adults reported mold in their home caused by damp interiors and poor ventilation, and many of whom also suffer from respiratory illnesses such as chronic bronchitis and asthma. And overcrowding is also a major concern. Indigenous communities are twice as likely to live in crowded housing compared to non-Indigenous Canadians, and that has substantial impacts on mental health, sleep, and the spread of infectious diseases. And Indigenous peoples are also disproportionately impacted by climate change. And as climate risks like flooding, wildfires, and extreme temperatures intensify, more Indigenous people will face displacement and health risks, which further widen existing health disparities. And colonial policies created and continue to create one-size-fits-all housing, resulting in Indigenous housing that is energy inefficient, overcrowded, culturally inappropriate, and not designed for local climates. And this situation further leads to a multitude of other challenges, including poor health outcomes. And so while the federal government and many provincial governments have recognized that the current state of Indigenous health is a direct result of colonial legacies, the reality is that many Indigenous people continue to live in poor quality homes, which contributes to negative health outcomes. And these challenges reflect the deep-rooted power imbalances that continue to shape both the health and housing systems. So really, it's decades of poor quality and inadequate housing that have disproportionately impacted Indigenous communities, causing severe health and economic impacts. And to build on the last slide, on average, Indigenous people in Canada experience higher rates of illness and shorter life expectancy compared to non-Indigenous Canadians, a reality that many Indigenous people attribute, at least in part, due to substandard housing. And the challenges facing Indigenous housing are multifaceted and deeply interconnected. Inadequate and inflexible funding is a longstanding challenge, and we'll discuss funding in a bit more detail later on. But it affects both the amount of housing that can be built and also the quality of existing homes. And additionally, when homes are built in community, they're often constructed to minimum standards with limited resources to ensure durability or high quality materials. And this can lead to higher long-term costs, both economically and in terms of health. Maintenance capacity is also limited. Without adequate funding, materials, or trained personnel, Issues like moisture buildup, air leakage, or structural deterioration go unaddressed, which can put even more stress on already limited housing stock. And at the same time, community members are rarely given the opportunity to participate in the housing design process. Instead, they're often left choosing between a handful of standardized designs that don't reflect local needs, preferences, or climates. And so these systemic issues result in homes that are unhealthy, overcrowded, and unaffordable. They're often uncomfortable and culturally inappropriate, and ultimately these homes are unsustainable and they fail to support the long-term well-being of communities. And so, as mentioned, these housing challenges have serious and far-reaching health impacts, both for Indigenous communities, but also the broader healthcare system. Respiratory illness like asthma and chronic bronchitis are widespread, driven by, as I mentioned, damp conditions, poor ventilation, and mold. Inadequate housing can also weaken the immune system, increasing vulnerability to illness. Overcrowding accelerates the spread of infectious diseases like tuberculosis, which is a severe and ongoing issue in many Inuit communities. And for individuals living with chronic conditions, poor housing can worsen symptoms and make disease management more challenging. Food insecurity is another major impact. In homes without clean water or homes suffering from energy poverty, maintaining adequate nutrition can become difficult. Again, mental health is also significantly affected. Poor housing conditions can contribute to chronic stress, anxiety, depression, sleep disruption, and have been linked to substance abuse and higher rates of violence. Poorly insulated and ventilated homes increase the risk of hypothermia, heat-related illnesses, and injury from falls, especially among elders. There's also a higher risk for house fires, particularly when unsafe heating devices are used. And communities reliant on polluting energy sources face greater exposure to air pollutants as well, which are linked to a wide range of adverse health outcomes. Radon exposure, especially in poorly constructed or poorly located homes, increases the risk of lung cancer. And critically, these risks are intensified with climate change and population growth, which place even more strain on already vulnerable housing system.
Okay, so time for another poll. Again, same instructions. If you kept it open, it should just automatically change for you. So the question we're posing is, which health impacts from poor housing do you most often see in your work or research? I'll give you a minute to get on an answer. I'm seeing some others come in, so if you want to use the chat function to expand upon that, we'd love to hear more. Definitely seeing a trend with mental health challenges. I think, and we'll talk about this a bit through the session, how that can be a real cyclical problem. So for others in the chat, we're seeing pest control and we're seeing an agreement with respiratory illness. Okay. Does it look like the um, results have slowed?
Thanks, Kayla. So in summary, poor quality housing causes severe and lasting health and economic impacts in Indigenous communities. Decades of underinvestment and colonial housing policies have led to unhealthy, overcrowded, energy inefficient, inadequate homes, which are directly linked to respiratory illnesses, mental health challenges, as we saw in the last slide, and injury, among other health impacts. And these unhealthy housing conditions are ongoing and cause immense suffering and preventable illness in Indigenous communities, reinforcing health inequalities and overburdening the healthcare system. And as previously mentioned, last year we released a scoping paper where we introduced the concept of healthy energy homes. And we use the term healthy energy homes to describe homes that are energy efficient, climate resilient, and designed to support the long-term well-being of the people who live in them. It's a concept that goes beyond just shelter. Healthy energy homes reflect a holistic approach, one that's really centered on people, community, cultural values, alongside energy efficiency and emissions reductions. And this is the approach that we're proposing for both deep retrofits and new builds in Indigenous communities, an approach that improves health outcomes, strengthens climate resilience, reduces costs and emissions, and supports self-determination as well. And so really healthy energy homes are more than just housing, they're also a preventative public health intervention.
So the healthy energy homes approach has many benefits to communities and people living with them. Health is just one of them. The image on the slide here is of a 3D concrete printed transitional housing project in Siksika Nation here in Alberta. This project is an example of how a healthy energy homes project can support community goals, integrate culture and values, and reduce energy. Although improving health outcomes for Indigenous peoples is one of the biggest positive outcomes of building more healthy energy homes, there are other associated benefits. These benefits of a healthy energy homes approach include reducing healthcare costs. So as healthy energy homes promote better health outcomes, there could be less demand on the healthcare systems and therefore reduced healthcare expenditures. They will reduce greenhouse gas emissions. So if more healthy energy homes are built in Indigenous communities, the emissions associated with poor housing conditions will decrease. For example, the Mi'kmaq Home Energy Efficiency Project, which started in 2019, has so far reduced greenhouse gas emissions by about 1,000 tons of carbon dioxide equivalent. That is the equivalent of taking 540 passenger vehicles off the road. Conservative estimates indicate that if Indigenous communities were able to switch to clean fuels, there would be an estimated total annual household reduction of emissions of 952,310 tons of carbon dioxide equivalent. There's also the benefit of saving community members money. So if all communities were able to complete energy efficiency retrofitting, there would be an estimated total annual operating cost savings of at least $185 million. Energy efficient homes help lower energy bills and therefore reduce housing costs. And another benefit is the better alignment with reconciliation. Healthy housing and self-determination over housing is called for within the United Nations Declaration on the Rights of Indigenous Peoples, or UNDRIP. Therefore, it is essential that investments in and building of healthy energy homes are done in partnership with Indigenous communities. Doing this would further the process of reconciliation by supporting self-determination and the human right to a safe environment, which includes access to clean energy and safe housing. Community members believe that changes need to come from inside the communities themselves. This would also recognize Indigenous people's right to self-determination and allow for locally responsive and appropriate housing strategies for each community's needs. Not listed on the wheel, another benefit is economic benefits. So investment in energy efficient Indigenous housing yields significant direct economic impacts, including creating over 47,000 full-time employment jobs, $1 billion in household expenditure savings over 10 years, and 11 billion in asset enhancement. This investment also yields major indirect and induced impacts, such as stimulating over 26,000 additional secondary jobs, avoiding an estimated 5 million tons of carbon dioxide equivalent um, of greenhouse gases and emissions over 10 years, and important health outcomes for community members. Okay. So as Carlin said earlier, there's a bunch of potential health impacts from unhealthy housing, such as increased respiratory illnesses and lung cancer due to common health stressors found in homes, like humidity, like particulates and radon, as she mentioned. This could really end up being a problem that snowballs negative effects and prevents us from seeing all those great benefits. Especially as the climate crisis brings more extreme weather events and air quality challenges. So, actions to develop healthy energy homes, such as insulating the home, air sealing the home, um, improving ventilation through mechanical ventilation, regulating the temperatures to battle the extreme heats and extreme colds that we're seeing with with climate change. Um, and transitioning to clean energy can all help improve indoor air quality. It can regulate temperatures. It could create a more safe home, help reduce mold, exposure to radon or other household toxins, and can lead to lowering healthcare costs by reducing hospitalizations and treatments for communities, even the who don't have local access to medical facilities, the cost to that community of traveling for those services, um, less housing related health impacts, so like respiratory, cardiovascular, infectious, chronic diseases would all decrease. And through it all, we'd see an improvement in mental health through improved well-being through improved housing and life or living. Sorry. We go next slide.
Thanks, Kayla. And so to understand why healthy energy homes have not been adequately delivered in Indigenous communities, we need to look at some existing barriers. And first, governance and accountability challenges are a core issue. For decades, Indigenous housing has been top-down and federally controlled, and yet many interrelated housing policies are treated as jurisdictionally separate, with provinces taking on different roles, leading to confusion around who's responsible. And this has really undermined adequate investment in Indigenous housing and meaningful policy integration. Additionally, different government departments are responsible for health expenditures and housing expenditures, and this stems from the way that colonial governments have divided responsibilities, addressing issues in isolation rather than as part of an interconnected system. And so at the heart of this barrier is jurisdictional fragmentation, siloed responsibilities, and overlapping accountabilities. And on top of that, funding for housing is often short-term, inflexible, and insufficient. Funding is also exacerbated by governance and accountability challenges. The federal government has stated that due to the high cost of addressing the infrastructure deficit in Indigenous communities, Indigenous Services Canada cannot fully cover housing costs. And on the ground, chronic underfunding forces housing providers to operate in a constant crisis mode, addressing only immediate health and safety emergencies rather than planning for the future, which is particularly important in the context of climate change. This year-to-year lack of sustainable and adequate investment in Indigenous housing has caused intergenerational disadvantages for Indigenous people and widened both the infrastructure and socioeconomic gap between Indigenous communities and the rest of Canada. And according to the Assembly of First Nations, closing the First Nations housing gap requires approximately $135 billion. ITK, the National Inuit Representative Organization, estimates around $55 billion is needed over the next 10 years. Meanwhile, the Métis Nation has requested just over $1 billion over 6 years to support safe and affordable housing. And finally, many Indigenous communities face limited administrative and technical capacity due to chronic underfunding and staff shortages. This makes it really difficult to plan, apply for, and manage housing projects. And at the same time, we lack reliable metrics to track housing-related health impacts, such as asthma linked to mold exposure. And these public health outcomes are rarely considered in housing performance metrics or funding eligibility, really reinforcing the divide between housing and health systems. So the housing situation in Indigenous communities has been a longstanding problem, and it will persist unless all orders of government take a different approach to address this issue. And that approach must be coordinated, holistic, and Indigenous-led, one that's grounded in the priorities, knowledge systems, and lived experiences of Indigenous communities. And housing is more than just infrastructure. It really is a determinant of health that's directly tied to physical and mental health outcomes. And a coordinated Indigenous-led housing strategy is also a public health strategy, one that really supports prevention and long-term wellness. And expanding access to energy efficient housing through policy is one direct way to improve Indigenous health outcomes. And by improving, as Kayla mentioned, indoor air quality, reducing mold and dampness, and creating safer and more comfortable living environments, we can lower the risk of respiratory illness, mental health challenges, and injury, among many others. And capacity building and empowerment are really central to this approach. As core elements of Indigenous sovereignty, they have been shown to reduce disparities in health outcomes between Indigenous and non-Indigenous communities. And as alluded to, at the same time, we need to track and measure housing-related health outcomes to demonstrate the full value of investing in healthy energy homes, investments that can significantly reduce strain and costs to the healthcare system over time. And ultimately, healthy Indigenous housing policy must bridge housing, energy, climate, and health, and not treat them as separate systems.
Okay, I think this is our final poll. So the question for this one is, what primary role do you think environmental public health professionals should play in addressing inadequate Indigenous housing? It looks like advocacy and policy influence might be the most popular choice, but building partnerships with Indigenous communities, governments, housing providers, and the energy sector is a close second. It is, yeah, difficult to choose one when there's many roles that the environmental public health professionals could be playing. So acknowledge that picking one from the list might have been a challenge, but thank you all for answering anyway. So healthy energy homes in action. Here at Indigenous Clean Energy, we're supporting the development of Indigenous energy efficiency housing projects through our Bringing It Home Project Accelerator program. The cohort-based program helps communities through capacity development and a grant that helps with what we call the cost of knowing the cost of a project, because it's not easy just to start a project without that capacity and without knowing what's all going to have to go into it. We're also working to develop alternative funding models by quantifying health benefits of energy efficiency measures by monitoring air quality and health data before and after energy efficiency retrofits. So that's an ongoing project that we're working on with some of our Project Accelerator communities. And then an example of this in action is in the Haltshick community. So Bella Bella, which is a remote community off the coast of British Columbia, is the main community of the Haltshick Nation, and it consumes 23 megawatt hours of power per year, which is more than double the average of the rest of the province. In response, the nation has created their community energy plan to address energy and climate change in their community. The plan includes initiatives such as development of a passive house kit, which would enable the nation to build their own homes from their own wood, and the continuation of work with partners to explore opportunities for net zero homes in their community. It also includes budgets for retrofitting and renovation enabling activities that will address health outcomes in their community. So these type of projects generate important co-benefits, including improving health outcomes, greater housing durability, and increased housing availability. Greater partnerships and funding are needed for programs like these to help close existing housing gaps and address related health challenges.
And so phase one of this work, which today's presentation is based on, really, as we mentioned, focused on our scoping report that was released last year. And that, again, really explored the connections between Indigenous housing, health, energy, and climate. And it brought together evidence linking housing and health in Indigenous communities and introduced healthy energy homes as a holistic policy solution. And phase two, which is currently underway, really builds on that foundation. It identifies key policy barriers that are preventing the widespread delivery of healthy energy homes at the federal, provincial, and territorial level. And it also provides concrete, actionable recommendations to help governments better support this approach. And phase two has been shaped by insights from our virtual gathering last year, which brought together around 40 experts across Indigenous housing, health, energy, and policy. And phase two also draws on various rounds of key informant interviews conducted this year with Indigenous leaders and practitioners from across various sectors. And the final report will be released in early December. And we're looking forward to actually returning in February to share those results in a follow-up webinar to this one. So to conclude, poor housing is a public health issue. Inadequate, overcrowded, and poorly ventilated homes contribute directly to respiratory illness, mental health challenges, and other adverse health outcomes in Indigenous communities, as we've seen, which also drives up healthcare costs and strain. And healthy energy homes deliver co-benefits and are a worthwhile and smart investment. They are energy efficient, climate resilient, culturally appropriate, homes that improve health, well-being outcomes, drive down healthcare costs, reduce emissions, lower household costs, and support reconciliation. However, coordinated policy reform is needed. Current policies are fragmented and not aligned with Indigenous needs. We really need long-term, flexible, distinctions-based investments that are co-developed with Indigenous leadership and really grounded in health equity. And public health professionals have a critical role to play. This includes, as we saw on the Slido, advocating for housing as a key determinant of health, supporting the integration of health and housing data across sectors, and working in partnership with Indigenous communities to advance housing solutions that really promote overall well-being and long-term resilience.